Monitoring of dyspneic patients is not really easy. The first thing is the clinical monitoring we do. So we look at the respiratory rate, respiratory effort, and as soon as respiratory rate and respiratory effort decrease, it's likely that the patient is not that hypoxic anymore, but it's just a subjective parameter. What we have to take care about is not just to look at respiratory rate, because some patients decrease in respiratory rate if they worsen with the respiratory distress, as they require much more respiratory effort. Therefore, I think it's important to watch respiratory rate and respiratory effort. The other thing is we could use some monitoring, apparative monitoring as pulse oximeters. And as most of you know, pulse oximetry in dyspneic patients, it's not really easy to place it at the tongue or somewhere. So we especially use a reflecting pulse oximeter probe as shown here. So here's the pulse oximeter going through the inlet of the Intensobox. If we place the pulse oximeter probe at the tail of the patient, we usually get a pretty reliable signal and get a pretty reliable oxygen saturation reading of the machine.